Our patient today is a 25-year-old female who just received an MRI with a diagnosis of degenerative disc disease. She's a little bit worried about that, so I'm just going to go and chat with her. How's it going, Lindsay?
Going good.
Good. I know that you are a little bit worried about that MRI finding, but I just kind of wanted to talk to you and explain that degenerative disc disease is something that happens to everybody, and it just kind of happens over time. And while yours might be a little bit advanced, I think it might be more of a nervous system issue than it is a spinal issue. And what I mean by that is just that your nerves can become sensitive and they can signal pain more often than what is normal. So pain doesn't always mean that there's a tissue damage. You can have pain signals even without damage. So I think it's more of a nervous system problem.
So what's wrong with my nervous system?
So nothing's wrong with it technically, but I just think that your nerves are a little bit more sensitive. So what happens is when your nerves sense something, they send a signal up to the brain. All different areas in the brain kind of they like take it into account and kind of try to decide if it sends a pain signal out. So think of it like an alarm system. So if say you touch something hot on the stove, your body's going to send a signal up to your brain. It's going to set off that alarm to tell your brain something's going on. The brain's going to send a pain output to, so that you take your hand away and prevent you from burning yourself too bad. Does that make sense?
Mm-hmm.
So when your nerves are sensitive, even something just like a light touch sets off the alarm system to the brain to do a pain output. So when your nerves are more sensitive, it's easier to set off that alarm system. I also know that you mentioned that you've been really stressed lately and having some anxiety. Have you been coping with that, or have you had anybody help you out with that?
No, not really.
Okay, so your emotions can really have an effect on your rehab outcome, and they also can affect kind of how sensitive those nerves are, because they really kind of take into account the environment. So if they're always like in a really stressed environment, they're going to be more sensitive. Does that make sense?
Yeah.
So I have some colleagues and I could refer you to get some help with that. Is that something that you would be interested in?
Yeah, that'd be wonderful.
Okay, awesome. So I'll get that referral taken care of for you. Do you have any other questions for me?
No.
Okay, awesome.